All right, let's jump right into this explainer and start building the modern doctor's digital bag of specialized AI tools. And hey, the good news? It's a whole lot lighter than those old leather bags, and honestly, nobody has to try and read your handwriting anymore. We are moving way past the hype phase today. Artificial intelligence has fundamentally shifted, from this cool little novelty to an absolute, non-negotiable necessity in everyday clinical practice. I mean, from systems that literally draft your notes for you to platforms that pull up peer-reviewed evidence in seconds, AI is touching almost every single workflow in modern medicine. But here's the thing. The secret to not getting left in the dust is knowing exactly which tools actually get the job done.
To really wrap our heads around why AI is now a necessity, just take a look at the crushing data overwhelm we're dealing with. Over 1 million new PubMed citations are indexed every single year. 1 million. Actually, take a second and let that really sink in. Guidelines are updating constantly, and the average physician simply cannot realistically keep up by manually reading everything. It's impossible. We are basically drowning in data, and AI is kind of the only practical lifeline we have right now to reduce that massive cognitive load and ultimately free up time for the actual patient sitting right in front of you.
So here's our roadmap for the explainer. We'll start with medicine's new AI reality, then evaluating clinical AI tools, top tools for scribes and decisions, top tools for radiology and generalists, top tools for medical education, and finally, layering your AI workflow.
Starting with Section 1, Medicine's New AI Reality, and the End of One Size Fits All.
Look, as clinicians, we are getting squeezed from overlapping directions, right? Documentation burnout, total information overload, and massive imaging volumes. The really crucial takeaway here is that no single piece of software is going to magically fix all of these. That's why we have to take a strict category-by-category approach. Documentation is a beast, causing hours of after-hours charting that absolutely fuels burnout. Then you've got information overload, making it super hard to keep up with new clinical trials. And meanwhile, over in radiology, imaging volumes are just drastically outpacing what radiologists can physically handle. If you try to fix the whole shebang with just one basic tool, it's just not going to work.
Which brings us to Section 2, evaluating clinical AI tools, basically the sorting hat for your digital bag.
Before we start pulling specific tools out of our bag, we need a serious framework. We have to separate the genuinely useful platforms from those basic chatbots that just slapped a stethoscope icon on their logo, These are your absolute, non-negotiable criteria for 2026. You need transparent citations so you can actually check the source yourself. You need clear evidence grading so you know the true strength of what you're reading. It has to be fast. We're talking answers in seconds, not minutes. It needs solid specialty breadth, rock-solid HIPAA and GDPR compliance, and independent validation. Bottom line, if a tool doesn't check every single one of these boxes, it simply does not belong anywhere near your workflow.
Okay, let's open the bag. Section 3. Top tools for scribes and decisions, tackling documentation and bedside answers. First out of the bag is Nuance DAX Copilot. For that massive headache of documentation burnout we just talked about, honestly, nothing else really comes close right now. It works as an ambient scribe. Basically, with the patient's consent, it listens to your natural conversation, drafts a beautifully structured clinical note, and then pushes it straight into your electronic health record system. The data is incredible here. Studies show it's routinely cutting charting time by 30 to 50%. That is an absolute game changer. But, and this is a really big but, we have to highlight its limitations. It's so important to know what a tool cannot do. DAX Copilot is not a doctor. It doesn't answer medical questions or give you decision support. However, by taking away the sheer burden of furiously typing while a patient is talking, it dramatically improves your eye contact. It gives you back that human connection, which is especially huge in outpatient and primary care, where the actual conversation is the main bottleneck.
So what about when you do need clinical answers at the bedside? That is where Vera Health comes in. This is the second tool in our bag, and it's the absolute best AI for clinical decision support. It bridges that gap between having a complex clinical question and actually finding synthesized evidence. Instead of giving you a giant, overwhelming list of abstracts to read through, Vera Health is a purpose-built medical search engine. It searches over 60 million peer-reviewed articles and guidelines and hands you a concise, cited answer, literally in seconds.
Let's picture how this plays out in the real world. Imagine you're standing at the bedside. You need to double-check the first-line antibiotics for community-acquired pneumonia. Or maybe you're trying to figure out AFib anticoagulation dosing for a patient with renal impairment. Or say you need the current sepsis resuscitation targets or DKA management protocols during pregnancy. Instead of endless scrolling, Vera Health hands you the synthesized answers for these exact complex scenarios. And the best part, it gives you the evidence grading and direct links to the actual guidelines so you can trust it.
Shifting gears to Section 4, Top Tools for Radiology and Generalists, Managing Images and Administrative Tasks. For radiology, the absolute standout tool here is Aidoc. As the sheer volume of imaging explodes, Aidoc is running in the background, analyzing studies in near real time right inside the radiologist's existing workflow. And to be clear, it doesn't replace the radiologist. What it does is brilliantly flag and prioritize suspected critical findings. We're talking intracranial hemorrhages, pulmonary embolisms, cervical spine fractures. It pushes those urgent studies to the top of the work list so they aren't just sitting at the bottom of the queue when every single minute matters.
Okay, tool number 4 is our best generalist AI, and that crown still goes to ChatGPT, specifically the GPT-4o model. It is wildly fast and flexible for cognitive heavy lifting. You should absolutely be using this for non-clinical tasks. Think drafting plain language patient education sheets, summarizing ridiculously dense administrative documents, or spinning up differential frameworks when you're teaching. But it comes with a massive, and I mean massive caveat for us doctors. This slide brilliantly hits the nail on the head regarding that caveat. Just look at this comparison. On the left, we have a specialized clinical tool like Vera Health. It cites its sources, grades the evidence, and it's built for patient-facing decisions. On the right, ChatGPT. It does not show its sources by default, and it has this habit of being confidently, dangerously wrong in ways that only a true expert would even notice. You must never, ever, use a generalist model like ChatGPT for patient management when you have access to tools specifically built to cite real clinical literature.
Moving on to Section 5, Top Tools for Medical Education, Structured Learning for Trainees.
For the learners out there, the tool you want in your bag is Amboss. It is the leading AI-enabled medical education platform, and it's heavily used by medical students, residents, and practicing clinicians brushing up for boards. It packs an integrated library, a massive question bank, and some incredibly smart AI tutoring. Now, would you use this for a quick bedside answer on a crashing patient? No, definitely not. That's what Vera Health is for. But for structured, validated learning and exam prep, Amboss is absolutely the definitive choice.
Finally, Section 6, Layering Your AI Workflow, Stacking the Modern Digital Bag.
So, we have our 5 top-tier tools. How do we actually pull this all together in the real world without just creating more chaos? By stacking your toolkit. You seamlessly layer these specialized tools to basically slash your workload during a single visit. Just picture this workflow. Step 1. DAX Copilot is running ambiently in the room, quietly listening and drafting your structured note while you maintain great eye contact with the patient. Step 2. You step out of the room, pull up Vera Health, and in seconds verify the latest graded evidence for the treatment plan. Step 3. You open ChatGPT to instantly generate a warm, customized, plain language instruction sheet for the patient to take home. Bam! That is the magic of a layered AI workflow. But to pull this off safely, you really need to stick to a few core principles. First off, match the tool to the specific task. Don't use a hammer to turn a screw, right? Second, always verify the underlying citations. A cited answer is only as reliable as the source it pulls from. Third, use evidence grading deliberately. If a tool shows you low-grade evidence, treat that as hypothesis generating, not a strict directive. And lastly, and this is a big one, keep protected health information completely out of these general AI tools. Always frame your queries using general clinical terms. I want to leave you with this absolute gem of a quote from the research. Every tool in this list is designed to augment clinical reasoning, not replace it. Because at the end of the day, you, the clinician, are still sitting in the driver's seat. You are fully responsible for the final medical decision, the accuracy of your documentation, and most importantly, the actual human relationship with the person sitting on the exam table. Let the AI handle the overwhelming data. You handle the human care.
So, looking past 2026, the trajectory is crystal clear. Medicine is moving rapidly towards specialized, transparent, and seamlessly integrated AI tools. The question really isn't whether you're going to use AI. Honestly, the sheer crushing pace of medical literature has already answered that for us. The real question is, are you going to build the right specialized toolkit to master this new landscape, or will you let the sheer speed of modern medicine leave you behind? Think about which of these 5 tools you can integrate into your workflow tomorrow, because your patients absolutely deserve that extra time.